Okay. So 157.
Okay. You start. Greetings from Tokyo and welcome to the Productivity Talk. My name is Mochtan and I am with the Asian Productivity Organization. The Productivity Talk is our efforts to update about current issues, where we also exchange views and also share best practices on current issues that are related to productivity. Today, we will discuss about Korean experience in handling COVID-19. And the focus of our discussion will be on crisis management. This means we will be looking at responses, we will be looking at actions, at decisions, at the mobilization of resources, and all in the constraint of time. Crisis connotates urgency, and therefore speed and time are of the essence. And the type, the magnitude and of a crisis, and also our familiarity or the lack of familiarity also add to that constraints. And therefore, in crisis management, we will be looking at one, preparedness, second, sustainability, and third is resilience. And in this case, is about our health sector and medical facilities. All in all, actually, we will be looking at the public sector productivity at work. And I am very pleased today we have joining us for the discussion two very distinguished speakers who have been very directly involved in handling this issue of the outbreak of the COVID-19 in their respective countries. The first one, broadcasting from Seoul, is Dr. Wonjae Lee. He is from the Seoul National University Hospital, which is the leading institution in the country in combating this COVID-19. Let me greet Dr. Lee. Annyeonghaseyo, Dr. Lee. Thank you for joining us.
Yeah. Thank you so much for having me today.
And the second speaker is we have the Honorable Secretary Karlo Nograles, and he is the Secretary, Cabinet Secretary of the Government of the Philippines, and also he has been handling the COVID-19 on the Philippine side. So mabuhay, magandang hapon sa inyong lahat, Sir Karlo. Thank you for joining us. Yeah. So let me now invite Dr. Lee. Yeah, and let's start actually when it comes to this COVID-19. One of the keyword is actually flattening the curve. Yeah, and Korea has been actually recognized as one of the countries that has been successful in flattening the curve of those infected. But I would recall when at the beginning, actually the cases in Korea actually increases so fast. And it was like bushfire, it spread so quickly. And it gave the impression that what Korea was doing was too little, too late. Yeah, but yet Korea managed to flatten the curve. And perhaps we can start the discussion with your views, what your experiences on how Korea was able to handle and flatten that curve. Dr. Lee, please.
Thank you. So I'd like to add a brief about me. I'm an interventional cardiologist working at Seoul National University Hospital. So I'm not actually representing any organization or public organization, but I'm speaking as a medical expert who are working in Korea and who knows the situation better than anybody, I suppose, here. So, very good question for me. So it is true that we did have some surge in the number of patients in the beginning, and we have to admit that that has been actually a huge problem for us.
Mm,
At the beginning, people weren't aware that much about the seriousness of COVID-19, and we didn't do, let's say, social distancing well. And actually, we are the country who has been open our border from the beginning. So we might not have been successful for controlling
mm,
people from outside. But anyway, something did happen in Daegu Gyeongbuk area, and which was coming from mostly the church called Shincheonji. Um, where the start is, I think what we have done well is how we controlled it. So let
mm,
me give you some point. A lot of countries has been saying that Korea has done a massive number of tests, and then somebody asked, why did you do it, and what was the decision about it? But I think it wasn't some decision, but we were just following standard protocol, which was set after experiencing MERS. So
mm,
the criteria for testing aggressively was actually similar to other countries. High risk for
mm,
visiting or meeting people from China or contact history with the COVID-19 and symptoms. That was the beginning. Um, but what we did differently was we did thorough tracking of people who contacted who were diagnosed with COVID-19. We were using cell phones and we did thorough interview, and we were using other data just find out who are the secondary contact from these people. That's why you could
mm,
be able to contain at the very beginning. And second factor is that we have been a little bit flexible about the criteria. After 29th patient has was diagnosed, there were some expert concerned about now community spread. So meaning without having concrete history of meeting people with high risk people, it's possible that they might have disease as well. So I'll just
mm,
give one example. It was just after 29th diagnosed with 29th patient. It was a pretty big hospital in Seoul, and then a patient came in with chest pain and a myocardial infarction was suspected. He didn't have a cough or sputum or neck pain, but as a standard protocol, chest X-ray was taken, and there was some suspicious lesion. So the ER doctor ordered CT scan right away, and he found pneumonia. So although he didn't have history, this doctor had some hunch and had some suspicion of pneumonia. They ordered this COVID-19 test. Of course, he was isolated at the very beginning, and he was tested positive, and they could contain the disease just in the ER and not spread the whole hospital. This was possible because government changed a rule. If a doctor have a suspicion for the COVID-19, then even if they don't meet the very strict criteria, they're able to do the test. So we have been a
mm,
little bit flexible to doing the test to contain the disease. And second thing was when this Shincheonji church, they had a huge outbreak. You know, that they test, a lot of them tested positive. So for them, if they are the people from Shincheonji Church and they highly be contact with these people, even they did not have symptoms, we did all the tests also. So whenever there's higher risk, we didn't just stick to the strict rule, but we adapted to it, and then we did more tests and tests just to contain that in that area, not to spread outside. I think that has been key factors. But I have to mention one more thing again. If we did
yeah,
not have the ability to do the test, we couldn't do all
mm,
these things. What
yeah,
was possible was that we developed the test kit for coronavirus in just 3 weeks. And this was
mm,
possible because both private and public work sector worked together. So
mm,
we actually had some capability of these testing kits from the private sectors. So one of the company just started developing it, and they made up this kit in 2 weeks. But usually in Korea, to take this test kit to the market, it takes like 90 days at least. But
mm,
this time, since the instead of the MERS, government has a new policy. For this kind of crisis, we have something called expedited authorization process, and it only takes a week, maybe 2 weeks. So development in 2 weeks, making the product, and then government take just 1 week to approve. In 3 weeks, we had this product in the market for the private use as well. So we could handle all the massive tests to meet the requirements.
Yeah. Well, thank you, Dr. Wonjae Lee. Well, you mentioned a couple of important key points here. One is the rigorous testing. Yeah, and then the second is also protocol is in place already. Yeah, based on your previous experience, be that MERS, be that the swine flu, or be that SARS, for example, that happened in the previous years. But you have a protocol. But the other important thing is also that I think you have not mentioned it explicitly, is that what I assume is you have the medical personnel. Yeah, and how do you mobilize this group? How do you mobilize these people, the medical care and the medical personnel, so they will be there in time and do all this that are supposed to do under the protocol?
So basically, around 90% of medical personnel or medical industry, actually, the hospitals are private sectors. About 10 to 15% public sector. So actually, the dominance is with the private sector. But still, we are under one payment system, which is government. So many players are the private sector, but government do have control over all the healthcare industry. That's why we could easily mobilize and start all this work at the very beginning. Just looking at the medical personnel, let's think about the Daegu Gyeongbuk area, which has a huge outbreak. So this happened, a lot of patients diagnosed every day, 100 patients are diagnosed. And then just public sector alone cannot handle it. But we have this protocol. When this outbreak happens, there are certain private hospitals who are designated to open screening centers. So public sector definitely do screen centers, but they cannot do all the work. The private sectors are also participating in screening process. So that's one thing to make the front line. And second, luckily there was one hospital, moving into new facility. So they had about 10,000 beds available in the center of Daegu. And then this private hospital decided to let government use for the COVID-19. But still, the people are lacking to working in there, right? To cover these 1,000 beds. What we did was, first, we have a military force. So Korean men are mandatory to serve in military. So I did myself worked in military as a medical officer. So first, they mobilized these people to come in and work in Daegu Gyeongbuk area. That was the first thing. And military nurses as well. They were sent down to this Daegu Gyeongbuk area. Still, it wasn't enough. They called for private help, and major hospitals in Seoul and Daegu as well. These people sent out their team to this hospital, and others just volunteers. As far as I know, about 10,000 doctors, 10,000 nurses, they just said, hey, I'm going to work here to, help with Daegu people. And that's what we happened to cope with this situation.
Thank you, Dr. Lee. So then that's another key, and that is the participation. Yeah, be that on voluntary basis, but also for those who has actually previously trained background and they participated in the effort. Let me now invite Secretary, the Honorable Secretary Nograles. And Sir Karlo, may I invite you to share what is the experiences in the Philippines?
Yes, certainly. So just to give everybody a timeline of how it happened and it occurred in the Philippines, January 30 was the first incident of the Philippines having its first patient with the COVID-19 case. This was a female tourist from Wuhan, China, who was visiting in the Philippines. Then during that month, January, immediately after the first case was recorded, we immediately convened the interagency task force on managing emerging infectious disease. So that provided us a mechanism with different cabinet secretaries involved with their respective jurisdictions and mandates coming together for a whole of government approach in terms of combating the disease. Then immediately a travel ban was issued against China, Macau, Hong Kong, and Taiwan on February 2 and February 9, respectively. Then on March 6, we recorded our first local COVID-19 infection. This was a man without any theory, but frequented a prayer room in San Juan City in Metro Manila. So that prompted the president to immediately declare a public health emergency and increase our code red sub level 1, our preemptive call to ensure that the national and local and public and private healthcare providers would prepare for an eventual increase in cases. Then on March, then immediately the president declared a state of public health emergency throughout the Philippines on March 8. Then our national capital region, Metro Manila, was placed under community quarantine on March 16. Then eventually, the president declared the entire island of Luzon under the enhanced community quarantine. And this was supposed to be lifted on April 13, but we decided eventually to prolong the enhanced community quarantine and extend it until April 30. So by March 18, a state of calamity was declared by the president, and that allowed national government and the local government units to utilize our quick response fund. So basically, under the structure of the Philippines, although we are governed by the national government, we have local government units, and each of them can access their quick response fund under a state of calamity. So that freed up a lot of funds to be used for us on the national level to be able to manage the crisis, and for the local level, under the local level, to have the freedom to also manage their respective localities using the quick response fund. So basically, that is how we manage the situation in terms of the national sphere. So in terms of our structure, the interagency task force, the one I was speaking about, was retained as the policy-making body that spells out policies in terms of how to manage the crisis. And this is chaired by our Secretary of the Department of Health. But it retains its function as a policy-making body. But under the National Action Plan, we also have the implementers of the program. So the policy is dictated by the Interagency Task Force, but in terms of implementation, we have what you call a National Task Force COVID-19. And the one who chairs that is our Secretary of National Defense, and it is co-chaired by our Secretary of the Interior and Local Government. And even beyond that, we also have a chief implementer who is the one in charge of implementing everything down to the lower level. And under that structure, we also have a task group on resource management and logistics. We have a task group on response, and we have a task group on strategic communications. So basically, our National Action Plan is to provide clear, accurate, and timely information. Number two, to implement measures to avert new cases and to facilitate the detection, identification, and isolation of COVID-19 carriers, and to mitigate the impact of the disease in our social, economic, and even the personal security of all Filipinos. So then obviously, because we are under enhanced community quarantine, loosely referred to as a lockdown, then we have to contend also with having no economic activity, and a lot of people not being able to go to work and not being able to fend for themselves and make their own money, so to speak. So the president, what the president did was he immediately convened or asked our Congress to immediately convene in order to pass a law that will allow him the measures, not only to enhance how we handle COVID-19, but also allow him to be able to use some funds to be able to provide for the most marginalized sectors of our society. So if you try to understand where the Philippines is coming from, a lot of our constituents, our citizens, are actually belong to the poorer sector or the low income sector of society. So therefore, with the law being passed by Congress, we were able to address the needs of 18 million Filipino families. So the Philippines is actually roughly we're made up of 24 million Filipino families. So we targeted 18 million Filipino families to take care of. And we are actually on the process of implementing that right now from the national government towards the local government units. And it's the local government units that help in the distribution of this it's what we call a social amelioration package that is given to each of the 18 million families. And depending on the region where they live, we provide them about 5,000 pesos to 8,000 pesos just for the month of April. And the budget is allocated so much so that we can also provide the same amount to them next month on May. So after we did that, we sort of were able to get feedback from those in the middle income families who are also asking for help. So what government is doing right now, we're currently crafting a measure in order to provide the same amelioration package to the lower middle class income families. So the 18 million families that I was speaking about mostly come from the informal sector. And this next package, it will be for those in the formal sector. So we will be able to address also the issues that they need. Now, in terms of our health actions, obviously what we want to do right now is to increase our health capacity well, first of all, the testing capacity, just going with what Dr. Lee was saying. We actually have conducted already about 45,486 tests right now. And these are PCR lab-based tests. No? And out of that, as of April 15, we've been able to record about 5,453 COVID-19 cases. We've had 349 deaths so far and 353 recoveries. But what we want to be able to achieve is for us to increase our testing capacity to hit about 8,000 to 10,000 tests per day. Right now, we're currently on a 3,000 tests per day capacity. So just like in Korea, we've also had a collaboration between the private sector and the public sector to create our own testing kits. This is done by the University of the Philippines National Institute of Health and the Manila Health Tech Company. And right now we are undergoing field implementation. So we're already done with the field trials. So now we're under the field implementation phase of 26,000 tests to be conducted under the field implementation phase. But once that's done with, we're looking at having 94,000 tests to be manufactured, or test kits to be manufactured by the Manila Health Tech Company, which will be made available to other laboratories. So we're having, our challenge right now is to increase the number of laboratories that are equipped and capable of conducting these tests, these RT-PCR tests. Right now, we've accredited 16 laboratories so far, but there are about more than 50 who've signified their intent also to be accredited as laboratories. So we'd like to expand the number of testing, lab-based testing that we will be conducting so that we can test, isolate, and then treat. And we've already identified additional quarantine facilities as well in order for us to start isolating even those who are awaiting their test results, because there's a 24 to 48 turnaround time for those test results to come out. Then just very recently, the president already ordered the purchase of rapid test kits. Now I know even in the international community, a lot of question marks or questions have been raised about the effectivity of those rapid test kits or even its accuracy. But what we're doing now is we're finalizing certain protocols in order for us to utilize it to the best way possible so that we don't sacrifice the accuracy, because we were told that at the very least, those rapid test kits can be used as confirmatory tests for patients who have already recovered from the disease. If you're IgG positive after recovery, then it's sort of a clearance that you've already developed the antibody against the COVID-19. So instead of getting clearance via getting a swab and going to the lab for the PCR test, perhaps a rapid test kit is enough for a patient who has recovered from COVID-19 to be discharged from the hospital. So we are finalizing the protocols in order for us to use the rapid test kits in conjunction with the PCR lab-based kits, because our current protocols also dictate that even if you get the rapid test kit, you have to undergo a confirmatory test with the PCR lab-based kit as well. So that's just what we're trying to do in order for us to address the gap that we're trying to close in terms of testing.
Thank you very much, Sir Karlo, Excellency. I think from the two presentations, the experiences is slightly different. What I can see that both have mechanism already. The protocol is there, but there is a quite different approach in Korea. When Secretary Karlo mentioned about in the late terms is a lockdown, but I didn't hear that in Korea. So Dr. Lee, is that did Korea practice lockdown at all, and how the government perceive that? The importance, the necessity of a lockdown. Because there are various places, there are various interpretation or definition of quote-unquote lockdown. Can you share with us the case of Korea?
Are you mentioning a lockdown of a certain area or lockdown a country from other countries?
Inside, because out from the country.
Oh yes.
Actually, you restrict. There is travel bans. That is actually a closure. But within Korea itself.
Okay, so I think I'll just show this slide right now, and I can move on with what you just asked. Let me show you this one. So okay, so can you see the slide? So
yes,
on the right, sorry, it's in Korean, but on the right, you can see a map. And this is a map of Korea Peninsula. And then where you can see very red area, this is where the huge outbreak happened. If you see the number here, the number of patients in just this small area, it's about 9,000, which is more than 80% of all the patients diagnosed in Korea. But you can see other areas. It's not that much, showing even we had a huge outbreak in small region, but without a lockdown, we were managed to contain the disease in that area only. So that's, I think, a very important thing. And I want to talk about how we could do it about this without lockdown. So I think the first thing is that um, after seeing a lot of patients surging in that area, people were very strict about following the rule, washing the hands and wearing the mask and keeping social distance. And what else? People from Daegu Gyeongbuk area, you know, unlike some exodus happened in other country, they did not go anywhere. They just stay in their area. For example, actually, I myself is from that area, and my parents lives there. And with COVID-19, I was so worried. I just called them. How about thinking about coming to my house to stay for this period? And but what I hear was, no, we're gonna stay here. And if we go there, I might be infected. And I might cause some problem to you, and you are a doctor, and you might cause some problem to your parents. And it was a story that I could hear from a lot of my friends coming from that area. So we did not have a lockdown. And if you want to, you could easily just get on the bus or train, and they can come to Seoul or any part of the country, but they did not. So I think public education and citizenship is also very important for containing this disease. And at the same time, not to speak of people doing effort, washing their hands and staying at home to further prevent if infecting other people as well. So, well, there can be a lot of different thoughts about this lockdown, but for us, if people are reasonable and they do not panic, I don't think lockdown is always the best measure to do for these people, because doing a lockdown, if people are very calm about it, just hearing about lockdown and things like that, that might cause some panic as well. So I think it's controversial, but I can say that we could succeed without lockdown.
Yeah. Well, thank you. And there is a question actually to Secretary Karlo. And when we're talking about actually identifying, and question is whether the Philippines has digital platform to trace the people who have contacted those infected. Actually, is there any digital platform?
Yes, in fact, the IATF already asked or directed our Department of ICT, Information Communications Technology, to assemble a small group in order for them to look at digital and ICT, digital platforms and or ICT solutions in order for us to be able to help the policymakers in terms of tracking the disease and contact tracing. So they've launched a staysafe.ph digital platform already to help us in our contact tracing. And because of the lockdown situation, the enhanced community quarantine situation that we have, just recently, our national economic advisors, the National Economic and Development Authority, assembled a small group as well, and it's a public-private partnership where they're also launching a digital platform in order for us to be able to track the bottlenecks in our supply chain management. So that was just recently approved by the IATF yesterday, and they'll be launching that soon. Another digital platform that we're currently using is the Rapid Pass system in order for us to be able to enhance the flow of of people and vehicle transportation going in and out the checkpoints or the quarantine checkpoints that we've set up all over Luzon. So using a phone and the QR code, our law enforcement agents can easily scan the QR code of each and every passenger or vehicle that passes through the checkpoint, to find out if they are accredited or given permission to pass through checkpoints. So these are some of the ICT solutions or digital platforms that we're currently using. The Rapid Pass will also be able for us to be able to see movements also of people who have the QR code. So through through a geospatial platform, we'll be able to see the movements, and that will help us also as policy makers as well. So that, and there are other groups also that are doing some sort of even in the private sector, doing digital analysis, big data analysis on their own as well. I'd also like to add that our lockdown, quote unquote lockdown, or our enhanced community quarantine also only is limited to the entire island of Luzon. So that's the northern part of the Philippines. But we've left Visayas and Mindanao local government units to decide on their own based on certain parameters if they would also impose community quarantines within their localities. So basically, it's the entire Luzon that has a common set of rules in terms of the enhanced community quarantine. And the Visayas and Mindanao localities, it really depends on their governor or their mayor, but they have to coordinate all their efforts with our Department of Interior and Local Government, as well as the Department of Health. But the challenging thing about all of these things is the flow of goods, especially food, food and medicine and essential items. So what we did was, in order for us not to complicate everything, we said that all cargo must flow unhampered. So regardless of whether it's food or essential medicines, just to simplify things, as long as it's cargo, it must flow through unhampered. We've had some challenges in imposing this because I guess the instinct of certain localities is that at the beginning they didn't want even cargo to pass through their localities because they didn't want to have to do with any possible carriers carrying COVID-19, whether they were just even truck drivers or helpers of truck drivers. As long as they were passing through their localities, at the beginning they blocked the roads and not allow anyone to pass through. But that was an initial challenge, but we've been able to overcome that. But as in any lockdown with any other jurisdiction or country, I guess the challenge really is one of those challenges would be how do you get food, medicine, and essential items to flow in and out.
Thank you, Secretary Karlo. And Excellency, just a follow-up question that we actually received also from one of our viewers. This is actually from Josie from India. And the question is the Philippines using some penalty measures to maintain social distancing for the success of the quote-unquote lockdown there? Yes.
Well, the law that was passed by our Congress imposed certain penalties for violations of that law, and it has to do with fines and fine or imprisonment of 2 months or both.
Oh, yeah. Thank you very much, Excellency. Let me then go to Dr. Lee. At the outset, I talked about speed, actually, yeah, and what is actually quite well, by a coincidence, this COVID actually also the spread or the speed of the spread is actually very fast, and the other character is that it stays long. Yeah, I mean relative long. We had previous experiences with SARS, for example. It was actually perhaps fatality rate is higher, but I think to the best of my recollection, it was shorter. Yeah, by now, tentatively, actually, what I gathered is about 2 million people is already infected, and practically all over the countries. Yeah, I mean, the entire world is not free, it's not immune from this COVID. So in relation to that, yeah, what is actually how do we minimize basically? And this is a question from Mr. Haq from NPO Bangladesh, from our colleague in Bangladesh, and how Korea actually minimize the virus of COVID-19.
So I think the biggest difference between MERS virus and this COVID is that this one might not as deadly as MERS, but the problem with this disease is that this has a lot of patients who are asymptomatic, but who are carrying the virus. So asymptomatic carriers so many, so not that they don't even know they have this disease and but they can infect other people. That's why it's spreading so fast and so many people. Recently, there are so many studies coming out. When they are infectious, even they're asymptomatic, before develop symptoms, 2 or 3 days they can have virus and they can infect other people as well. And the day before they become symptomatic, they have a very high titer of virus already. So that's why it's so hard for us to control. So definitely dealing with the diagnosed patient and preventing second is very important at the very beginning. But as you mentioned, now we don't really know where they went. Maybe I might have, and I might have recovered. Because so what we should do and what's actually help working in Korea, I think, is again 2 things: washing hands and wearing mask. So I'm in my room and I don't have colleague right now, so I'm not wearing it. But when I'm out, I'm always like this. And when I go out and when I go subway, I take a subway, I always wear a mask. So I think now there's so many asymptomatic patients. So let's say I might have infected, but I don't really know. I might sneeze. But if I'm not wearing this mask, if I just sneeze, I might just spread this virus to other people. But now everybody's wearing this mask, whether they have disease or not. Scientifically, or the communities, the professional communities in the past, they said this is to protect other people when you are symptomatic, because if you cough, you're going to infect other people. But if you flip the coin, if everybody's wearing this mask, especially when we do not know whether we have virus or not, then we are protecting each other together. So I think this is very important. So we should do at this moment is really follow the very basic measures. Wear a mask. When you get home, wash your hand. You might have touched somebody with the COVID virus, but if you come home, you wash your hand with soap, they will go away. So that's what I think what we can do at the moment.
Okay, thank you. Dr. Lee, let me continue. There is a question from our colleague in Mongolia, Akembayar. And this is about actually, because in a number of places, in a number of countries, the measures taken include actually closing schools. Yeah. So then the question is, if or when schools are reopened, then should the country invest in testing all returning students? Yeah, these are the secondary school students, for example. Yes, then should they be tested? Yeah, so that is the question. And at this point of time, yes, they are still closed, but when the schools are reopened, should testing be done? Please.
So you're saying should tests being done for these students? That's what you're asking.
Yeah.
Well, I don't think that will be a very effective measure. So unless they have symptoms, if they have symptoms, actually they should stay home and not go to school. But they're asymptomatic. I think there is no reason to test those people, because these young people, especially going to school, it is high likely they are most of them will not be, um, most of them, if they are infected, they'll be made asymptomatic. And so people might concern and they just gather up and they're gonna have this, let's say share this virus and, prepare it to other people. But if we if we just fear that and then test all of them, I think that's going to be a waste of our resources. As Secretary Carlos mentioned, we have to allocate certain resources at this point. We never know how many patients will be there, and at some point there will another outbreak as well. If we just waste this resource like that, and I think that's not a good idea. So actually Korea now trying to experiment online schooling at the moment, but I think it's really challenging, as you might expect it. So I think in a few weeks, I think schools will open and we'll know what happened after that. But definitely testing for all those people, I think it's not recommended.
Thank you very much, Dr. Lee. And that is what I said in the beginning, whether we underreact or whether we overreact to the situation. The proportionate measure should be done. And that is very, very useful, actually, insights from you. Let me also read and convey another question from the viewer. And this is from New Zealand this time. This is Dr. Robin Mann. And the question is to Dr. Lee, and perhaps it also could go to Secretary Karlo. And that is, what is the long-term plan for controlling the virus? And what is the exit strategy? Yeah. I'm not asking you yet when, but actually I'm asking you what at this point of time. So can I go first with Dr. Lee, and the same question also to Secretary Karlo, please?
So, I mean, this is a very difficult question, but the experts think that this will not end easily, and probably eradication of this virus might not be possible. And some experts say now we might have to just live with the virus, just like other influenza. They might go under control for several months, but still they might resurge again. And a lot of experts think there's high possibility. So I think we at some point we will have to find a way to live with this virus until we have this vaccine or very effective cure. And some people will be optimistic at the very beginning, maybe June, maybe July, with the summer coming, it will go away. But I don't see any experts saying that. It will at least go down the road to end up this year. And many say it's going to be more years. So I think if we are wise enough, it's time for us to really live with the disease, not think about really just getting out of it and ending the situation.
Thank you, Dr. Lee. Excellency Secretary Karlo, may I have the same question? And I just repeat that now in the case of the Philippines, the long-term plan for controlling the virus and the exit strategy.
Well, I had the privilege of attending an ASEAN +3 summit the other day. So it's with the ASEAN, and the +3 would obviously be Republic of Korea, People's Republic of China, and Japan. Okay. So this was one of the topics that was discussed, and one of the countries that joined the discussion in that summit said that I think our medium-term plan, short to medium-term plan, must concentrate on looking for the proper treatment, because the longer term plan would be the vaccine. And experts say that the vaccine, we won't be able to get the vaccine until 2021. Let's put it that way, with clinical trials and tests and all of these protocols and procedure that they have to go through before it's given the green light. So we have to accept the possibility that a vaccine, the earliest possible time for a vaccine to actually be developed and be made available to all countries would be 2021. That being said, what we should concentrate on would be the treatment. And the Philippines has actually agreed to be one of the countries in the clinical trials to be conducted and facilitated by the WHO. And the Philippines also indicated its willingness to participate in whatever clinical trials with Japan for the drug called Avigan. So as far as our country is concerned, we want to be able to participate in clinical trials as far as treatment is concerned. And that's what we're open to doing, if only to be able to help the world find the proper treatment. And obviously, it would benefit whoever patients in the Philippines who agree to be part of those clinical trials. Then, right now, since we're on an enhanced community quarantine, our April 30 is the date when we are supposed to make a decision whether or not to extend that or to sort of modify it. And our economic managers are now talking about ways for us to be able to determine what sort of industries would we allow to operate, how much of the workforce in those respective industries we would allow to go back to work. Obviously, we would encourage still work from home arrangements. And when school starts and we don't have a solution to this problem, then perhaps those online courses. We're actually already conducting online courses. Some universities have already begun doing that. But as far as basic education is concerned, that's still something that we have to really think about in terms of its feasibility, given the number of students and the internet connection and all of these other factors that we have to take into consideration. So we have a group that's looking at that. But going back to the ASEAN +3 summit, one of the agreements that we in the ASEAN with the +3 countries have agreed to do moving forward is we have to find really a way wherein trade is not restricted between our countries. Trade must continue. The exchange of goods and people have to continue. We have to look for a way wherein ASEAN as a region does not suffer economically because of the socio-economic repercussions of COVID-19. If we don't find a way wherein we can live together and trade together and enhance people exchanges and even exchange on trade of goods and services as a region. Otherwise, we're all going to fall into a recession. So that's a work in progress. At the very least, we've tasked our economic ministers, our finance ministers, our trade ministers, and our foreign affairs ministers to start talking and discussing what the ways forward would look like. But that being said, I don't think anybody has a definite answer to the question. It's all just in the planning stage right now.
Well, thank you so much, Secretary. And well, I can, as Dr. Lee mentioned, we will have to live, with the virus. We have to learn to live by the virus. I'm fine with that. But the worrying part is, in some countries, the mortality rate is high. And therefore, how can we say that we need to accept and living with it? I think there must be actually a way that we need to treat better Yeah, and I agree. I'm very encouraged what Secretary Karlo was saying, that the Philippines is ready to be the, for the testing, and also not only with WHO but also with Japan. But can you, Dr. Lee, talk a little bit more about this mortality rate? So, because otherwise it will be very, very scary. Yeah, you are saying that it's going to be here, it's going to stay with us, live with it, but yes, the risk is so high.
Yes, that's very true. Some experts say differently, but still the WHO thinks that the mortality rate is around somewhere about 2%. Because I think in Korea, we have around 2% mortality. So it's based on, since we have done a lot of tests, so we think that we might have done all the people who are suspect to have them. And then among them, we have this diagnosed patient, and among them, we have this deaths, people who are dead. So probably since we have done a lot of tests, maybe 2.0% might be the mortality rate. It is really high, actually. Normally, the influenza that we experience each winter, it's about zero point 0.5, or it's around 0.5%, I think. So it's much higher. In some countries, it's even lower. But I think that the higher death rate happening in other countries, I think it's because of they weren't prepared for this huge, this coming, and then the lack of resource. I think it played a huge role, because COVID-19, yes, it can be deadly for a very old patient who has comorbidities. And statistics says that even in Korea, people over 60 or 70, they have very high rate of death. It's about 7 and 8. It's very high. But among very young patient under like 30, it's actually nearly zero. Meaning, if you can support this patient, then most of them, of course, still got 2%. Most of them can go through without going to this, strategy direction. Um, so if we can support this patient even without, magic pills of this cure um, agent, if we can help the patient go through the period, let's say people might have some pneumonia, not devastating, but some pneumonia, they might just need oxygen 1 or 2 liters or 3 liters few days. Then after few days, their immunity system comes up and they can recover. But a lot of countries where death tolls are very high, they don't have that sort of resource to even provide those very simple measures, and they end up having a lot of death. So I think if the medical resources are properly uh, uh, distributed, then I think we can still live with this virus and treat severe patient, then have them in the hospital, and still what we have right now, just oxygen, maybe sometimes mechanical ventilation. I think we can still save these patients even now without a cure agent.
Dr. Lee, and we think that when we take care, and perhaps one of the most important is what you mentioned just now, and that is mechanical ventilator. Yeah. What if there is a lack of this ventilator? What may happen? Yeah, because now it is very difficult, then it becomes very scarce, it's not sufficient. Yeah, and if you are saying that is a crucial, and what might be the alternative? Yeah, because otherwise again we are back to the situation, yeah, that we cannot handle because the proper equipment is not there.
Well, it's again a very hard question. So for now, I don't think there is any measure, any device that can replace mechanical ventilation. As you said, it can be scarce. Not many countries are good with it. Then that's time when we have to make some decision where to put our resources. So I'm very sorry to tell you that there is nothing that can replace this mechanical ventilation when they're needed. So if we don't have that much equipment to provide all the people, then that's the time we have to think about where we are going to focus our resources.
Okay, well, I would like to end the discussions on more an optimistic note. Yeah, meaning that I would like to try to from discussion to find out, is there light at the end of the tunnel? Yeah, and what will be our hope that that we can have that? Can I invite first Dr. Excellency Secretary Karlo, and then after that, Dr. Lee. So what do you think? Can we see the light at the end of the tunnel already?
Yeah, like I said, I think right now, obviously we like in the Philippines, will be quite dependent, to tell you honestly, we'll be quite dependent on the other more developed countries to be able to look for that vaccine. I mean, if you're really talking about light at the end of the tunnel, I think our hope will be pegging our hope on that vaccine. And that's why it's very encouraging to us whenever we hear news about large pharmaceutical companies, well on their way to developing that vaccine. That being said, the strategy right now is the treatment. So our country is now focused on increasing our testing capacity, enabling us to isolate the cases. Again, then after our detection and isolation, then medical intervention and the treatment. We want to see more recoveries and less deaths. Basically, that's what we're trying to focus on in order for us to be able to get a grip really and manage this situation well. And once we're able to do that, the current challenge now is jumpstarting the economy or going to that bounce back phase in our economy, because right now we're on a standstill, so to speak. Although the lockdown or the quarantine is strictly on Luzon, we're really talking about our national capital region, where most of the economic activity and most of the other islands in the Philippines is dependent on, and it's really the center of commerce and even governance. So that being said, I guess for all countries, I think the challenge really is managing, and this is what I picked up from our discussions at the ASEAN +3. Each and every country have their own particular challenges in terms of managing the situation locally. But that's the first step. And after each and every country is able to manage it locally, then we can start now talking about how the interaction between countries can come back and bounce back. Because this has affected, the COVID-19 has affected the world economy itself. But the priority right now is managing it locally within your own territory and jurisdiction. At the same time, parallel to that is start talking about how you can bounce back or get back to the trade between countries. I think there will be a shift in the economy in terms of right now. I think most of the economy will now be shifting towards a digital economy, e-commerce, health industries. Everybody will start now talking about and concentrating on health industries. And then we already now have to really think about being resilient, our health resiliency, not just in terms of each and every country, but in terms of the entire world. I think we've talked about resiliency against climate change, resiliency against economic shocks, but now there's a new language in town, and that's resiliency on health shocks or health pandemics or things like that. It's something that has taken a backseat for so long, but right now, if anything, COVID-19 has opened up our eyes that we must also become health resilient as well.
Thank you very much, Excellency. May I invite Dr. Lee, please?
So I think there are two things I want to talk about. So I think, as Secretary Karlo mentioned, we will have cure for this disease and vaccines, because now we are in different era and there are a lot of biologics and different tools to develop drugs. And actually, there are many companies locally or globally, small and big. They're testing their drugs, whether they're going to work or not. So I think at some point we will be able to treat this disease. And also vaccine, it's going to take a longer time. Probably, as you mentioned, I also think it's going to take more than a year. But at some point, we will be able to have this vaccine to fight with disease. But what are we going to do until then? How are we going to wait until those times? I think I've shown the slide earlier. Still, without those cure or vaccine, there are measures to contain this disease locally. I've mentioned this many times, washing hands, that's what you can do every day, and wearing mask and having social distancing. And when you have symptoms and just staying at home, those simple measures really helped Korea to flatten the curve already without all the medicine. So I think every country also can do that as well. So if every country just follow those rules, and then even before we are having these new tools like a cure and vaccine, I think we can be able to see the end of this fighting with this disease.
Thank you very much. And the team informed me that we have actually still so many questions, but we have already passed 1 hour. So let's close here. And what I would like to mention on behalf of the Asian Productivity Organization is to thank you, everyone, especially the speakers as well as the viewers. What we discuss is actually only one side of the coin. The other one is actually, Secretary Karlo has mentioned several times, that is the economic side, which is actually also huge. That is also looming very large. But that will be a different session. And so thank you, everyone, and thank you, the team. And my wish for everyone to stay safe and healthy. Thank you so much.
Thank you so much.
Thank you.